Hello and good day. My name is Julia Finnerty, and I'm a market manager with United Healthcare Medicare Solutions in Colorado Central, which is the greater Denver metropolitan area. At United Healthcare, we are committed to helping people live healthier lives and to make the health system work better for everyone. I have a passion for our mission, and I hope to share some information with you that will help you decide if you are getting the most of the benefits that you worked so hard to qualify for. Not one size fits all, so we recommend that you consult with a local and licensed United Healthcare Medicare agent. They will work with you to complete a personal needs analysis that will help them recommend the best plan to fit your individual healthcare needs, lifestyle, and situation. When we talk to Medicare beneficiaries, they often tell us that they find Medicare extremely confusing, kind of like a bowl of alphabet soup. You're peering into that broth, you see the letters, but they don't form any words and they don't often make much sense. When we talk to Medicare beneficiaries about what's important to them when considering the plan that's going to follow them into their golden years, what do they think of? Affordability. Why? Because when most of us retire, we retire on a fixed income. Another thing that they tell us is they're looking for the Medicare plan that's going to be there for them for the long haul to be stable and reliable. They're looking for reliability and stability. And lastly, commonly, ease of use. Why is that important? Because if you don't understand or know how to use your benefits, you could become frustrated. And frustration raises our blood pressure, and that isn't good for any of us. Stability, affordability, reliability, and ease of use, why should these be important to you? Because when you find those qualities within the Medicare plan supporting you, it means you have found a partner in care that will be by your side throughout your journey. Are you getting the most from your Medicare plan? Are you getting all of the additional benefits that you worked so hard to qualify for? Do you even know what those additional benefits might be? You have options, a full bowl full of options. Say that 3 times fast. Depending on where you live and what you qualify for, many Medicare Advantage plans offer additional benefits, such as prescription drug coverage. Did you know Original Medicare does not include prescription drug coverage? What about dental coverage, vision coverage, an annual allowance for eyeglasses, hearing aids? What about a quarterly allowance to help you purchase over the counter supplies and supplements? Or would transportation assistance to and from your doctor's office be beneficial? Would you like to join a fitness club for nothing? A free membership to a fitness club, brand name, or a local mom and pop that you might work well with? At United Healthcare, we have one of the largest national networks for fitness membership. Brain health? What about support with buying healthy food? These additional benefits, why would they be important to you? Perhaps it's because you want to live your best life now and well into the future. Taking care of your whole self allows you to do just that. Having access to these additional benefits allows you to do just that. Take care of your whole self. Options to keep your whole self healthy, your mind sharp, and your body active. Now, let's take a quick look at Medicare and all of the additional benefits outside of what Original Medicare offers that you may qualify for with a Medicare Advantage prescription drug plan, veterans plan, or even a dual eligible plan. Dual eligible plans are plans designed specifically for those that qualify for both Medicaid and Medicare. If that is you, you may qualify for extra help and extra benefits. Here's our agenda. We're going to try and help you understand your Medicare choices, a little bit about eligibility and enrollment, the advantages of Medicare Advantage plans, prescription drug coverage. We're going to take a look at just two of the many options offered by United Healthcare for Medicare Advantage plans in the Denver metro area for plan year 2022, agent assistance, why United Healthcare, and additional resources. Medicare is a plan that most Americans qualify for when they turn 65. If you qualify, you will automatically be enrolled in Part A, which covers hospital expenses. The government picks up the cost for this enrollment. You will want to enroll in Part B, as in boy, which covers your doctor visits and outpatient care. The great majority of us will be responsible for the premium for Part B and will be penalized by paying higher premiums if we do not enroll when we are first eligible. The premium for Part B will vary, with higher wage earners paying more. Now let's get into a little bit of this alphabet soup. Medicare does not cover prescription drugs, and on average, you will be responsible for approximately 20 to 25% of the overall cost for your medical expenses. After you enroll in Medicare Part A and B, you have two options to improve your benefits. Option one, you can purchase a Medigap or a Medicare supplement plan. These plans are offered by private insurance companies, and they help pay some of the out-of-pocket costs that come with original Medicare. You will pay the premium for the Medicare supplement or Medigap plan, and those premiums often increase as you age. You will also need to purchase a Medicare Part D plan to help pay for prescription drugs. It's important to remember that there's also a penalty associated for not enrolling in Part D coverage or enrolling late. Option two, choose a Medicare Advantage plan, also known as Part C, as in combined or choice. Part C Medicare Advantage plans are also offered by private companies and typically combine all of the above, Part A, Part B, and Part D into one comprehensive benefits package. There are many reasons more and more Medicare beneficiaries choose to enroll in a Medicare Advantage plan. The most obvious is the affordability of these plans. Even though you will continue to pay your Part B premium, most typically will no longer have to pay for their Part D prescription drug plan premium, as these benefits may now be included in your Medicare Advantage plan. Depending on where you live, you can often find a zero premium or low cost Medicare Advantage prescription drug plan. One of the most attractive things about Medicare Advantage plans are the extra benefits that may be available to you. As I mentioned before, coverage for vision, eyeglasses, dental benefits, hearing aids, transportation benefits, over-the-counter benefits, fitness benefits, even a healthy food benefit for those that are dual eligible. You are eligible for Medicare Parts A and B if you are a U.S. citizen, a qualifying legal resident, 65 years old, have a qualifying disability, or other special situation. Your initial enrollment for Medicare Parts A and B starts the 3 months before your 65th birthday, includes your birthday month, and the 3 months following your birthday. After enrolling in Parts A and B, you may also choose to enroll in Part D for prescription drug coverage, or choose to enroll in a Medicare Advantage prescription drug plan, which includes Parts A, B, and D. You will have an option each year during the annual enrollment period to add, drop, or switch your Medicare coverage. The annual enrollment period begins October 15th and ends on December 7th of each year. There is also a yearly open enrollment option for Medicare Advantage members. In January of each year, if you are already a Medicare Advantage plan member, you will have the option to disenroll from your current plan, switch to another Medicare Advantage plan, or even go back to original Medicare. You have this option once between January 1st and March 31st of each year. Special needs plans have their own unique eligibility and enrollment requirements. Another reason to consult with a local and licensed United Healthcare Medicare agent. If you have a change in lifestyle or find yourself in certain circumstances, you may qualify for a special enrollment period. Examples would be retiring after age 65 and losing your employer health coverage, moving, marriage, divorce, qualifying for extra help, or even being diagnosed with certain qualifying chronic health conditions. Contact your agent as soon as possible if you find yourself in one of these circumstances to discuss your options. As of May 2021, there are over 27 million people enrolled in a Medicare Advantage plan. On average, they spend 25% less on their health care over original Medicare. And they have a 93% satisfaction rate with their Medicare Advantage plan. Now let's take a look at why many of us might want to choose a Medicare Advantage prescription drug plan over original Medicare. If you will notice the two columns on the right hand of this exhibit, there is one in darker blue that shows the benefits that a Medicare Advantage plan may cover. That they do cover. But look at the light blue column with original Medicare. There's only 3 checks there. Do you notice some gaps? They both have coverage for hospital stays. By purchasing Plan B, they both have coverage for medical care like doctor visits and some preventive services like flu shots. But then we have some gaps. Original Medicare, no coverage for prescription drugs, no coverage for vision, no coverage for hearing, exams, hearing aids, and most importantly, for the majority of us, no annual out-of-pocket financial protection. Original Medicare does not include an out-of-pocket maximum. Medicare Advantage plans do. An out-of-pocket maximum will protect you financially should you find yourself in a difficult medical year. We hope you never do, but should you have that situation, with a Medicare Advantage plan, your financial position is protected. You know what your out-of-pocket annual maximum would be for the cost that you pay toward your medical coverage before the plan pays for the remainder of that calendar year. That's not included with original Medicare. Now, here are 10 things that we'd like you to know about Medicare Advantage plans. You must continue to pay your Part B Medicare premium. These plans have you covered. By joining a Medicare Advantage plan, it may affect your current coverage, so please consult with a local and licensed United Healthcare agent. It's always going to be best to use network providers. Network providers offer you additional discounts, and it will always contain your out-of-pocket expenses. Some plans require you or may require you to use network providers. There may be options for you to find a plan that allow you to go out of network, but you will always have higher out-of-pocket costs. You may qualify for financial assistance. If you enroll in Part D for your prescription drug coverage late, you may pay a penalty. A Medicare supplement or Medigap policy is not a Medicare Advantage plan. Always keep your member ID card handy. And remember, Medicare Advantage plans offer the same protections as original Medicare. And with Medicare Advantage plans, you have that built-in financial safety net with the maximum out-of-pocket. Let's take a little time to focus on Part D prescription drugs. We're going to move away from the alphabet soup just to focus on Part D. Now remember, Original Medicare does not cover prescription drugs, but the coverage limits for these plans are determined by CMS. CMS, the Centers for Medicare and Medicaid Services. Depending on the plan you choose, you may have a deductible to meet before the plan begins to pay for eligible prescriptions. After your deductible is satisfied, depending on the plan you choose, you will have responsibility for either a copay or coinsurance for your prescription drugs. If your total drug costs reach $4,430, you will enter the coverage gap, or what's also known as the donut hole. During the time that you find yourself in the donut hole, your out-of-pocket costs may increase and your responsibility will equate to approximately 25% of your overall eligible prescription drug costs. Once you have reached a total out-of-pocket, which is what you have paid out of your own pocket for your eligible drug costs, you will enter the catastrophic coverage stage. During the catastrophic stage, your costs will reduce to a reasonable copay, and there are always lower cost options to choose from, such as generics. Generics will always have a lower cost option than perhaps a higher tiered drug like a preferred brand name. The information before you now outlines the difference between your total drug costs and your out-of-pocket drug costs. Confusing? It can be. There is additional information you will want to know if you qualify for extra help from Medicare to help pay for your Part D prescription drug costs. Another good reason to partner with a local licensed United Healthcare agent when considering your plan options. Now, when you choose a United Healthcare Part D or Medicare Advantage drug plan, we will continue to work hard to bring you a broad choice of pharmacies to choose from and savings when you use in-network retailers or mail order services. With a tiered formulary, you will enjoy lower costs for Tier 1 and 2 preferred generic and generic drugs, but you still have the broad coverage that you need and the options for Tier 3, 4, and 5 preferred brand name, non-preferred brand name, and specialty drugs. Keep in mind that your plan will offer you lower cost drugs that safely treat the same medical condition as your current higher cost brand name drugs. You may be asked to try the lower cost alternatives. There may also be limits in place to safely use a drug, and the plan may need more information from your physician to make sure that a certain drug is being used correctly for a medical condition covered by Medicare. There are always steps for you and your physician to take to ask for exceptions or to waive restrictions. Generally, the plan will make a decision within 72 hours. Now we're going to take a look at two of our most popular Medicare Advantage prescription drug plans that will be offered in the greater Denver, Colorado metro area for plan year 2022. I want to remind you that these are just two of the options, but for time's sake, we're going to compare two of our most popular plans. You'll notice in the blue column, the light blue column, you will see our AARP Medicare Advantage Plan 1, which is an HMO plan. An HMO plan, you will choose a primary care physician. Your primary care physician is going to be your medical director, your medical advocate, your navigator, if you will. Should you need specialty care, your primary care physician will refer you to a specialist within their network, someone that they know, that they work with, that they communicate with. On the right-hand side, In the white column, you will see our AARP, Medicare Advantage Walgreens PPO. Now, the Walgreens name there means that Walgreens is a preferred partner for United Healthcare, and they have promised us preferred pricing for your prescription drug costs. You do not have to use a Walgreens. If you do not have a Walgreens near you, you can use any one of our broad range of United Healthcare Medicare pharmacies throughout our country. The PPO has a little bit more flexibility for those of you that travel a lot within the United States. Perhaps you consider yourself a snowbird and have a home for winter and a home in another state for the summer. This plan may be for you. I want to point out, though, you will want to choose a primary care physician in the PPO plan. You still want that medical partner in care, someone to help you navigate the care. But you would not need a referral should you need to see a specialist in the PPO. The PPO gives you access to our nationwide United Healthcare PPO Medicare network. You can use any one of our nationwide PPO physicians and still be within your network benefits. Did you notice anything pretty exciting about both these plans? Neither one of these plans have a monthly plan premium. So even though you will continue to pay your Part B premium, there's no additional cost to enroll in either one of these plans. Something else. Neither one of these plans, the HMO nor the PPO, have an annual medical deductible that you have to satisfy before the plan starts considering your eligible medical expenses. Both the HMO and this PPO have a $0 copay to see your primary care physician. It will cost you nothing to see your primary care physician when you enroll in one of these plans. And you will notice scrolling down through the plan benefits that there are copays for your services. Copays, which means you will know what your cost is when you are going for treatment. Copays for inpatient hospital care, copays for outpatient surgery, copays for diagnostic tests and procedures. Did you notice anything interesting about the outpatient surgery copay? $0 copay should you choose to get your outpatient surgery at an ambulatory surgery center versus the typically more expensive outpatient hospital setting. Your choice, though, $0 copay, ambulatory surgery center, or you have the choice to pay a copay to get your surgery done at an outpatient hospital facility. Moving on through the benefits, you will notice everything is a copay. Outpatient x-rays, $15 on both plans. Lab services, woohoo, a $0 copay for lab services. As you scroll down, there's a copay for emergency care, and you should know that United Healthcare covers you worldwide for emergency services on both of these plans. In the middle of the page, the most important thing for your financial peace of mind and well-being here is that all-important annual out-of-pocket maximum that I keep talking about. Original Medicare does not include this protection. That's why many beneficiaries are now choosing Medicare Advantage plans. With our Medicare Advantage plans offered through United Healthcare, you have a built-in annual out-of-pocket maximum. Once you reach that maximum for your medical expenses, you are covered by us for the rest of the year. You know, should you have that difficult medical year, what your maximum exposure is going to be. Below that, you will notice that both of these plans include that Part D prescription drug coverage that you might have been paying for separately in the past or considering paying for separately. These are included and built in to these Medicare Advantage plans. Both of these plans have a $0 copay for your Tier 1 preferred generic drugs. You will pay nothing for either a 30-day or a 100-day supply, whether you choose to enroll in an HMO or this PPO. Copays as you go up throughout the tiers. Now, we all want to age gracefully. And it's very important that we take advantage of additional benefits in order to do that. Did you know that as we age, outside of the medical diseases that we all struggle with when we reach retirement age, our eye muscles become less flexible? So it's just natural, unfortunately, that as we age, we run into some difficult eye decisions, right? Because these muscles become less flexible, we often have trouble with night vision. We may lose some of our peripheral vision, and you will see some of us all running out to buy those readers. It is important to have these benefits. We all want to age gracefully, right? Having these extra benefits that you see before you that are built into both our HMO and the PPO plan, the examples here, allow you to do just that. There's one thing on this screen that's not mentioned, but are dental benefits important to you? They should be. Did you know that the bacteria from your teeth is the one thing that crosses over through your bloodstream to your heart? Very important dental health is, and routine vision care is right here for you. A $0 copay for your eye exam every year on both plans, and an allowance yearly to help you purchase your eyeglasses should you need them. Gym membership. I talked about our Renew Active. This is a really fun option for those of you that like to work out and keep your body strong and healthy. And again, I might have mentioned before, but we have the largest network offered to our Medicare Advantage plan members. We include national brands that you're going to recognize right away, but we also include some of the mom and pop local gyms that you may already be enjoying. And there's other programs built into this. For example, if you find yourself sitting at home, not interacting very often, would it be of interest to you to join a golf club or a hiking club? Or do you like to play cards? Would you like to join a card club or maybe bocce ball? There are all sorts of things this membership offers you. Did you know that outside of retirement age folks, that nearly 16% of all adults, regardless of age, report some loss of hearing trouble? And as we age, these statistics rise, with 33 to 50% of those of us at retirement or post-retirement age having difficulty hearing. So this routine hearing coverage benefit is extremely important to your overall social and active well-being. You can get a hearing aid as low as a $375 copay. Both plans, the HMO and the PPO. I mentioned the over-the-counter benefit. Both of these plans include a quarterly allowance to help you purchase supplements and supplies over the counter. And for our diabetic members, extremely important, please look at the bottom of the page. Currently, in the Denver metro area, our diabetic members are paying about $450 a month for their monthly insulin supply of insulin. We are working very hard to reduce costs at United Healthcare, and we're involved in a program that will allow our Medicare Advantage plan members to get a 1-month supply of insulin drugs for $35 or less. Now, these two plans, as well as many other opportunities for you, are offered in the following counties: Elbert, Adams, Arapahoe, Boulder, Clear Creek, Denver, Douglas, Jefferson, and Broomfield. By talking to a local agent, you will gain a valued partner in care, a partner in care that will help you identify participating providers in the large United Healthcare provider network. They will check your prescriptions for inclusion and cost. They will find out what's important to you and your lifestyle, what should be included in your plan for you. Do you qualify for extra help and extra benefits? How do you access the unique and extra benefits available to United Healthcare Medicare Advantage plan members? And how can United Healthcare work with the care you receive currently from the VA or TRICARE for Life and possibly offer you the additional benefits that you are not able to access today? Those vision benefits, those dental benefits, as an example. And by the way, if you're a veteran, we all thank you for your service. Choose an industry leader that more people choose for their Medicare plans over any other carrier. Choose an industry leader that has more than 40 years serving the Medicare community. Choose United Healthcare. You have our promise and commitment to helping you live a healthier life. When you need additional resources, United Healthcare has you covered. And we can also direct you to the appropriate agencies that you may need to reach out to. As I mentioned before, Medicare can be extremely confusing. One size does not fit all, and the alphabet soup that can make Medicare solutions hard to decipher, well, that's why we recommend consulting with a local agent, because we are all individuals with unique healthcare needs, lifestyles, and situations. So please set time aside to speak with one of our local licensed and certified agents so you get the most from the Medicare benefits that you worked so hard to qualify for. Do you know about all of your options? Are you getting those extra benefits? Those extra benefits that focus on our entire well-being and keep us at our best. Our local agents know the Denver marketplace, and they have the education and expertise to provide you with a personal needs analysis and recommend the plan that is best fit for you as an individual. United Healthcare is passionate about making a difference. We listen. We focus on benefits that make a difference for our Medicare members. And with so many options to choose from, you will want to find a partner in care that is affordable and has the strength, stability, ease of use, and reliability to give you the confidence that they will be there for you when you need them the most. A company that continues to thoughtfully reinvest in our communities and the additional benefits that you will want to take advantage of. Our local agents share our passion. They want to make a difference. And alongside United Healthcare, our providers and partners, we will all be there for you as your partner in care. I appreciate your time. I thank you for paying attention. I hope I helped you a little bit. I thank you for listening. And I wish you a happy and healthy future, living life as your best self and enjoying each day to its fullest.